First Minister's statement to press their request to speak buttons, and I call on the First Minister Nicola Sturgeon.
Thanks, Presiding Officer. I will update Parliament on Cabinet's review of the current lockdown restrictions. The review took place earlier today. Let me say at the outset that, with a limited but very important exception in relation to some early years and school education that I will come on to later, the Cabinet has decided that the current lockdown, including the stay-at-home except for essential purposes requirement, does need to remain in place until at least the end of February. In the course of this statement, I will give an update on the current state of the epidemic, which provides the context for that decision. I'll also give an update on the vaccination programme, and I will set out some of the additional measures we intend to take to get and keep the virus under control in the months ahead. And finally, I'll set out how and when we hope to begin the process of getting children back to school. Firstly, though, let me cover very briefly the latest statistics. There were 758 positive cases reported yesterday. That is 7.4% of all tests carried out, and means that the overall number of confirmed positive cases is now 181,291. 1,939 people are currently in hospital, which is a decrease of 19 from yesterday, and 143 people are in intensive care. That's the same number as yesterday. I also regret to report that over the past 24 hours, a further 69 deaths were registered of patients who first tested positive over the previous 28 days, and the total number of deaths under this daily measurement now stands at 6,181. And yet again, I want to send my deepest condolences to everyone who has lost a loved one. The level of COVID infections clearly remains too high. That is evident from these figures. However, the most recent figures provide further evidence that the lockdown restrictions are working to improve the situation, and that is, I believe, positive. Average daily case numbers have more than halved in the past 3 weeks. In the most recent week, up to 29th January, an average of 1,062 confirmed new cases were reported each day. 3 weeks ago, the average daily number was more than 2,300. Weekly case numbers per 100,000 of the population have also fallen from 302 in the week ending the 8th of January to 136 in the most recent week. Test positivity has reduced as well. In the 7 days up to 29th January, it averaged 6.6%. That is still higher, but it is closer than it has been in recent weeks to the 5% that the WHO considers to be indicative of an outbreak being under control. Now, pressure on the National Health Service does continue to be severe. The number of COVID patients being treated in hospital remains around 30% above the high point of the first wave back in April last year. However, hospital admissions in this wave do appear to have peaked on the 12th of January. They have now stabilised and are starting to reduce, albeit slowly. ICU numbers at this stage are more volatile, but they did not reach the peak of the first wave, and they also appear to have peaked in this wave and to have done so on the 18th of January. So all in all, the statistics do show real progress. However, this progress is down to compliance with the lockdown restrictions, and I want to thank everybody across the country for that compliance. However, the situation does continue to be fragile. Case numbers still remain higher now than they were in the week before Christmas. That means that if we were to ease restrictions too quickly, there is a real risk that infections would rise again very quickly. That risk is, of course, increased by the fact that the new variant of COVID, which is more infectious, now accounts for, we estimate, around 73% of all new cases in Scotland. I can also advise Parliament that Public Health Scotland is examining evidence suggesting that there may be an increased risk of hospitalisation of people infected with this new variant. However, at this stage, there is no statistically significant evidence of any increased risk of death. Public Health Scotland is continuing to analyse the evidence on both of these points, and we will keep Parliament updated. I can also advise Parliament that to date there have been 5 cases of the new South African variant identified in Scotland. However, all of these have links to travel, which means that there is no evidence so far of community transmission of that variant. All of what I've just set out underlines the need for continued and very extreme caution in our fight against COVID, especially if, as I think we all do, we want to get some children back to school later this month. That is why Cabinet has reached the conclusion that the lockdown restrictions must stay in place until at least the end of February. However, if our progress continues, then I am cautiously, and I stress cautiously, optimistic that as more and more people get vaccinated and with the protection of some of the additional measures that I will set out shortly, we may be able to begin looking towards a careful and gradual easing around the start of March, and I will give an update on that in 2 weeks' time. Let me now report on the progress of the vaccination programme. I can confirm that we have, as of this morning, given a first dose of the vaccine to 610,778 people in Scotland. That includes 98% of all residents in older care homes, which is a truly extraordinary uptake, and 83% of the number of over 80s we estimate to be living in the community. I'm going to return to that point shortly. In addition, I can advise that 21% of over 75-year-olds have already received the first dose, and we are on track to have vaccinated with the first dose all over 70-year-olds and all adults who are classed as being especially clinically vulnerable by the middle of this month. Vaccination of the 65 to 69-year-old age group is also underway from this week, and those aged 60 to 64 and unpaid carers will start to receive appointments from the third week of February. So we are making good progress in protecting those who are most at risk from COVID. Nevertheless, I expect there will be legitimate questions today about the overall number of vaccinations in Scotland compared to other parts of the UK. That is reasonable. However, I would make two initial points at this stage. Firstly, we have been very deliberately trying to achieve as high an uptake as possible in the top priority groups, and we believe we are achieving a higher uptake than elsewhere. So, for example, we haven't just offered vaccination to all older people in care homes, we have achieved an actual uptake of 98% amongst residents and 88% among staff working in older people's care homes. And that really matters in terms of reducing the burden of illness and deaths. Similarly, in the over 80s group, the 83% I reported earlier is based on a cohort number that we think is overestimated. The work we have been doing with health boards to refine these numbers suggests that the actual uptake amongst the over 80s group is already closer to 90%. These uptake figures are way beyond anything achieved in the flu vaccine programme, and vaccinating the most vulnerable to the greatest extent possible is really important, even if it takes more time to do so. It will help to save more lives. All of that said, though, it is clearly the case that overall volumes matter too, and that leads to my second point. As we make more use of mass vaccination centres for the younger age groups, we expect the daily rate to also increase. The figure reported today, for example, shows just under 35,000 first dose vaccinations were done yesterday, reflecting in part the opening of new centres. That is the highest daily number so far, and it is 55% higher than last Monday. So having achieved greater depth in the programme so far in the form of high actual uptake in priority groups, our challenge now absolutely is to accelerate on breadth in the form of numbers overall, and that is what we are doing. It is right, of course, that all of this is subject to close and ongoing scrutiny, and we will continue to provide the daily figures that allow that to happen. Now, as we continue to suppress the virus within our own borders and increase the protection of the vaccine, it is essential that we also guard against fresh importation of cases from overseas. This is particularly important as the virus mutates and new, more infectious and potentially more severe variants emerge. And as we look ahead, we must learn from past experience. We now know, for example, that by early July last year, we had almost eliminated COVID in Scotland, but then allowed it to be reseeded from, in the main, overseas travel. We must guard against that happening again. It is to that end that the 4 UK nations have already agreed that travellers coming into the UK from countries with a travel ban in place will be required to quarantine in hotels. That is a necessary measure, but in the Scottish Government's view, it does not go far enough. Firstly, there should be very few people coming from countries with a ban in place anyway. Second, this approach leaves open the possibility that people will travel into the UK from those countries via third countries. And thirdly, an approach that to manage quarantine that only includes countries where new variants have already been identified is too reactive, because often by the time a new variant has been identified through genomic sequencing, it will already have spread across borders. So the firm view of the Scottish Government is that in order to minimise the risk of new strains coming into the country, managed quarantine must be much more comprehensive. I can therefore confirm today that we intend to introduce a managed quarantine requirement for anyone who arrives directly into Scotland, regardless of which country they have come from. Obviously, we cannot unilaterally implement immediate managed quarantine for people who arrive in other parts of the UK before travelling on to Scotland, so we will continue to urge the UK Government to adopt a similar comprehensive approach. However, if they don't wish to do so, as is entirely their prerogative, we will ask them to work with us to reduce the risk amongst people travelling to Scotland via ports elsewhere in the UK. And we will set out more detail of how and exactly when the managed quarantine system will be operational as soon as possible. I understand how tough restrictions are for our travel and aviation industry as well, of course, as they are tough for individuals. So we will also look to work with the UK Government to ensure the sector gets the support it needs until such time as we are able to start to ease travel restrictions. It is vital, as I've said, that we guard against the importation of new cases, but it is also crucial that we continue to identify cases and break chains of transmission here in Scotland. We're already increasing the accessibility of testing, for example, by increasing the number of mobile test facilities that are available, creating additional local and regional test centres and making more use of fire service stations for testing in rural areas. Today, I can set out a further expansion of regular routine testing of those without symptoms. Firstly, we will from later this month widen the regular testing of healthcare workers so that it covers primary care workers in patient-facing roles, such as GPs, dentists, optometrists and pharmacists. From mid-February, regular testing will also be available to all staff who work directly with patients in hospices. We also intend to expand the availability of regular testing in other healthcare settings, such as addiction and mental health services. And we will introduce targeted testing to support some essential public service functions, including emergency service control rooms and NHS 24. Staff and patients in certain health settings obviously face an elevated risk of transmission, which is why it is right to have such a focus on those settings. However, we know that there are some industries which also have higher transmission risks, such as food production and distribution. So we are working with businesses in those sectors with a view to introducing routine testing for their workforces over the course of this month. Alongside these proposals to test people whose work potentially puts them at risk, we will be expanding targeted community testing, where testing is made available to everybody in a local area, regardless of whether or not they have symptoms. This can play a particularly valuable role in communities where prevalence is stubbornly high or where it is starting to rise again. In recent weeks, local councils have been submitting proposals for community testing, and we've been considering these in light of the lessons from the pilot projects conducted at the end of last year. Community schemes have already been agreed across 7 local council areas within the health boards of Fife, Grampian and Ayrshire and Arran. By the end of this week, we will have agreed community testing plans across the majority of mainland local authority areas. And in addition to that, mobile testing units are already being used for targeted community testing in Ayrshire and Arran, Dumfries and Galloway, Scottish Borders and Forth Valley. These testing units, which are offering tests to people regardless of whether or not they have symptoms, are already finding cases on a daily basis that would otherwise not be identified. The Health Secretary will in due course set out more detail of everything that I have announced today. Now, the purpose of increased testing, or one of the purposes of increased testing, is of course to help break more chains of transmission. However, that requires good support for self-isolation. The latest available survey evidence, which is UK-wide, suggests that there is good compliance with self-isolation, but we know we need to do more. I can therefore confirm today that we intend to extend eligibility for the £500 self-isolation payment to everyone on an income below the level of the real living wage. More details of this and the other steps we intend taking to support people required to self-isolate will be set out shortly by the Social Security Secretary. Presiding Officer, let me turn now to education, which I'm sure for many parents in particular watching is the information they most want to hear today. It is a statement of the obvious that all of us want to see children and young people back in full-time, face-to-face education just as soon as possible. The closure of school premises to most pupils right now is unfortunately necessary in the interest of protecting the country overall from the harm of this virus. But evidence of the wider health, developmental and social harms being experienced by children and young people concern all of us. And I have to say, and parents I know this will resonate with parents in particular, the concern is more with every single day that passes. I'm also acutely aware of the pressure school closures is putting on working parents and on family life more generally. Now, I have to be candid that our room for manoeuvre, given the current state of the pandemic, is limited. But I want to be equally candid, as I have been before, about the government's determination to use every single inch of headroom that we have to get children back to school, even if that means adults living with restrictions for longer. In short, the judgment the Cabinet arrived at this morning, and this is a judgment based on and taking full account of the advice of our expert advisers, is that if we all do agree to abide with the lockdown restrictions for a bit longer so that our progress in suppressing the virus continues, then we can begin a phased, albeit gradual, return to school from the 22nd of February, following the February midterm break. The decisions I am about to outline are intended to give young people, parents and teachers as much notice as possible, but of course I must stress that they are subject to continued progress in suppressing the virus, and they will be subject to final confirmation in 2 weeks' time. However, as of now, our intention is that from the week beginning the 22nd of February, there will be, firstly, a full-time return of early learning and childcare for all children below school age. Secondly, a full-time return to school for all pupils in primaries 1 to 3. And thirdly, a part-time return, albeit on a limited basis, for senior phase pupils to allow in-school practical work that is necessary for the completion of national qualification courses. Initially, though, it is intended that there will be no more than around 5 to 8% of a secondary school roll physically present at any one time for these purposes. We also intend to enable small increases in existing provision for children and young people with significant additional support needs where there is a clear and demonstrable necessity. Now, we will hopefully confirm these decisions in 2 weeks' time, and at that stage I also hope that we can set out the next phase of the gradual return to school, and also at that time set out even an indicative timescale for the return of in-person learning in our colleges and universities. Presiding Officer, before I leave education, let me make one additional point. I spoke about testing earlier on, and that is relevant here too. I can confirm that there will be a significant expansion of testing in educational settings to support the return to nurseries and schools in the weeks ahead. It is our intention that those who work in schools and those who work in early learning and childcare settings attached to schools will be offered at-home testing twice a week. All senior phase secondary school students will be offered this as well. This testing offer will be in place for schools as soon as possible to support their return on the basis that I have set out, and we will extend it to the wider childcare sector in the weeks that follow. We are, Presiding Officer, and I think I speak for everybody across the country when I say this, we are determined to get our children back to normal schooling and by extension back to much greater normality in their lives just as quickly as it is safe to do so. That is our overriding priority, and I think it is right that it is the overriding priority of all of us. For now, I want to again thank young people and their families, as well as teachers and school and nursery staff more generally, for the patience and understanding you are showing during these incredibly stressful times. Now, to conclude, we are making progress both in suppressing the virus and in getting people vaccinated. We need to do more on both of those fronts in the weeks to come. But the path ahead does remain difficult, and it's important to be candid about that. This virus is still circulating, not just here, but across the UK, Europe and the world. And of even greater concern right now, the virus is mutating. So we must remain vigilant and we must remain disciplined. To get the virus more under control and so that we can prioritise every bit of headroom we create to get children back to school, unfortunately, we must all stay at home, except for permitted essential purposes, for a bit longer, at least until the end of this month. And when we are able to start the process of slowly easing lockdown to give us all more normality in our day-to-day lives, we will have to accept that some mitigations, like physical distancing and face coverings, will be necessary for a while yet. And I am afraid we will also have to accept that the price of greater domestic normality is likely to be, for a period at least, not going on holiday overseas. These are not easy trade-offs, but they are essential as we continue our journey through and hopefully out of this pandemic. I am grateful to everyone for their continued sacrifice. I ask everyone to stick with it. Please stay at home, protect the NHS and save lives.
Thank you very much, First Minister. The First Minister will now take questions. Ruth Davidson.
Thank you, Presiding Officer. A return date for nurseries, early primary and part-time older years schooling is welcome and will allow parents across the country to plan. But it is clear that heavy restrictions will remain in place until enough COVID-19 vaccine is delivered to enough people. At the moment, all the evidence shows the Scottish Government's rollout is slow, stuttering and lagging way behind the rest of the UK. While we saw record highs elsewhere this weekend, on Sunday, Scotland saw the lowest number of JAGs administered since the start of the mass rollout over a month ago. As we said last week, the new mass vaccination centres, already open elsewhere, will help pick up the pace. But all throughout January, the First Minister has disputed any and all criticism. She's rubbished suggestions from GPs, patients and even the BMA that Scotland's rollout was sluggish and missing targets that it needed to hit. Her argument today is that we're starting to catch up on vaccinating the over 80s, but the same problem is happening in the next cohorts. Today's statement indicates that 21% of 75 to 79-year-olds have received the vaccine, which is good news for them, but is still just a quarter of the proportion vaccinated south of the border. And the problem extends to all of the over 70s. They're writing to us in huge numbers about another missed target. Last Friday, Jean Freeman said they would get invitation letters by the end of the week. They've been waiting, but it hasn't happened. So let me ask the First Minister, by what date will all over 70s now get their letter or be otherwise contacted? Will she now accept further offers of support from the armed forces? And will she now finally explain why the rollout in Scotland is so far behind?
First Minister.
Look, every single one of these questions is a fair question. I don't dispute that. And I'll address each and every one of them. Indeed, whether all of them are accurate is another matter, but they are all fair. And it's incumbent on me and the Government to make sure that we address them. I've not rubbished the concerns of anybody. In fact, we've worked with GPs and others to make sure that any issues that are being raised are appropriately addressed and any challenges that are being faced are overcome. In terms of the notion that we will be living with restrictions until all of us across the UK and further across the world have vaccinated significant numbers of people, that is right to a point. I think it is also important for all of us to be candid that given what we don't yet know about the impact of the vaccine on transmission, we may actually be living with some degree of restrictions even after we have vaccinated significant proportions of the population. That is why, because of what we do know about the impact of the vaccine, that it operates to reduce severe illness and death, that it is so important that all of us have focused first on vaccinating those who are most clinically vulnerable. In terms of the specific question about over 70s, all over 70s, every adult in the clinically extremely vulnerable group will have had a letter by the end of this week at the latest. But more importantly, we are on track to meet the target we set to have vaccinated everybody in these groups with the first dose of the vaccine by the middle of February. We have got to a higher uptake of over 80s ahead of the target we set for over 80s than I thought was possible that we would even just a week ago. Now, I'm not standing here denying that we want to accelerate the overall progress, and I'll come back to that point in a second. But nor will I apologise for having deliberately focused on maximising uptake in the most clinically vulnerable groups. So I can stand here and say that of the older residents in our care homes, it's not just the case, as is being said elsewhere, that they have all been offered vaccination. 98% of them have had the first dose of the vaccine. 88% of the staff working with them have also had the first dose of the vaccine. Now, it is important because that will help us save lives and reduce the burden of illness. Similarly, although we are, as I said in my statement, we are refining the numbers that we believe are in the over 80 cohort, we think that we are probably close to 90% now of over 80s actually having had the vaccine, and we will see the number in the over 70s group grow day by day over the course of this week. Now, let me come on to the point of overall rate of progress, because I actually do think this is legitimate. I want to see the daily rate grow and accelerate. That is why I look at today's number, and I will be looking even more closely at tomorrow's number and the numbers for the rest of this week. But the number we are reporting today of people vaccinated yesterday is 55% higher than the number last Monday, and is the highest daily number that we have recorded so far. That's our challenge now, having got the depth in these top clinical priority groups, is to get the breadth in terms of the overall acceleration of the progress in the programme, and that's what we are absolutely focused on.
Thank you. Jackie Bailey.
I'll come back to it.
Can I thank the First Minister for advance sight of her statement and welcome the expansion of community testing, which I raised with her previously. Can I also send my condolences to those families who have lost loved ones? Almost a year into this pandemic, we are all too aware of the negative impact lockdown and school closures are having on children and young people. Last Thursday, the Equality and Fair Scotland budget statement cited challenges for attainment, career progression, and we know that for those from disadvantaged backgrounds, these challenges will be felt even more acutely. Yesterday, the Institute of Fiscal Studies set out that by the time the pandemic is over, most children will have missed more than half a year of normal in-person schooling. The lifetime costs of this could be as much as £40,000. So the effect of COVID on lost learning could translate into lower incomes and higher inequality. Education Scotland are now releasing weekly reports that detail all the issues still facing pupils and teachers. First Minister, significant remedial action is still required over and above what's already been done. So can I ask her, firstly, what more will the government do to address this? And secondly, councils and parents have highlighted significant difficulties in ensuring provision for pupils with additional support needs. Consequences have been hugely detrimental to their well-being. So can I ask the First Minister what increases in provision will be offered and what criteria will be used to decide which pupils will benefit?
First Minister.
Well, firstly, I don't think anybody is anything other than deeply concerned. I know I am deeply concerned about the ongoing and cumulative impact on young people of having their school life so seriously disrupted. That is why the most important objective that we have as a government is to get young people back to school. I hope, based on what we have set out today, that that process will begin on the 22nd of February, which at the moment will, I don't know what other plans other governments will set out, but at the moment I think we are the first government in the UK to set out the start of that phased return, and we will want to accelerate that as quickly as we can. And that's important. That's the most important thing we can do to help young people not experience any further impact from COVID in that form. We will also, for some time, I think, be requiring to invest more and to provide more support to schools, to teachers, and indeed to parents to help children catch up in terms of the impact of lost time in school over the past year. And the Education Secretary continues to discuss with COSLA and with education interests exactly what form that will require to take over the medium to long term. In the here and now, the Deputy First Minister has already set out additional funding to give local councils the flexibility to do more, for example, around digital access to learning, or to provide greater support directly to parents, and we will continue to do that. Similarly, the Education Secretary, and I'll ask him to make more information on this available, we are looking on an ongoing basis at those with additional support needs, and that's why, as well as the phased return that I've set out today, we are also trying to increase the provision within the existing arrangements for those with significant additional support needs. of a situation that has been difficult in every respect for literally every person in the country, the impact on young people is the one that certainly grieves me most, and is the one that we will be requiring to pay attention to, I think, for longest. And let's focus on getting them back to school, but also doing everything we can to make sure that this is not the lifelong impact that some have expressed concerns about.
Patrick Harvey, to be followed by Willie Rennie.
Thank you, Presiding Officer. Expanding eligibility for the self-isolation grant is welcome, but there's clearly a need for a wider support package, and the Greens will bring that debate to the Chamber tomorrow. Quarantine measures for international travel are welcome too. Could have prevented so much harm if that had been in place in the months past, but it's good that it will finally be there. Parents, pupils and teachers all want schools to get back to normal, but this cannot be at the cost of safety, and the EIS are continuing to urge caution. The Greens have called for the expansion of regular testing for school staff for months now, and the Parliament backed that position in November. So in announcing a system of twice-weekly home testing today, can the First Minister tell us if it will be fully in place by the return date on February 22nd? And given that social distancing will be needed in classrooms, because we still don't know enough about transmission of the new variants, and in any case, many pupils will continue to need to self-isolate, isn't it clear that even a phased return must also be based on blended learning, with resources in place to ensure that teachers' workload is manageable?
First Minister.
The arrangements that I've set out today for twice-weekly home testing will be in place for schools as schools return on the phased basis from the 22nd of February. In the weeks thereafter, it will be further extended across other educational settings, early years, for example. There is also an existing provision that has been in place since schools returned back last August for any member of school staff who believes they have been exposed to the virus, even if they don't have symptoms, to access PCR testing. And I would take the opportunity to remind people working in our schools that that is available. In terms of the general questions about safety of schools, if I wasn't so concerned about making sure that everything we did was consistent with that paramount requirement to keep schools and everybody in schools and everybody around schools safe, we'd be putting every young person back to school as quickly as possible, because the impact on young people of being out of school is significant. But it is because we need to do that safely that we're taking a careful, gradual and phased approach to return. The new variant absolutely makes it essential that we continue to be cautious. I'm happy to ask the Chief Medical Officer to arrange a further briefing on what we are learning about the new variant for MSPs as soon as possible. I have certainly not seen any evidence that suggests that it is disproportionately affecting young people more than other groups, but it is, because it is more infectious, it is liable to infect all age groups more than previous strains of the virus were. As I've said today, Public Health Scotland is also doing some further analysis on some initial evidence that suggests there may be a statistically significant increased risk of hospitalisation, not particularly of young people, of the population generally associated with this new variant, and they're doing more work on that. So we need to continue to be cautious for all of these reasons. And my final point on Patrick Harvey's question about blended learning is that while we want young people back in school full-time, face-to-face, as much as possible, yes, we will need to have blended learning available as a contingency as we go through this next phase of the pandemic. The senior phase return that I spoke about earlier on will be on a blended learning basis. It will be limited in school face-to-face provision for essential practical work necessary for exam courses. But we need to have these contingencies to make sure that as we get young people back to school, we are doing that in a way that is consistent with overall safety.
Willie Rennie, to be followed by Annabel Ewing.
I've been raising it for some weeks, in fact months now, about the routine testing, so I'm very pleased that it's going to be rolled out on a wider basis, including in schools. But it wasn't quite clear whether the First Minister is going to make sure that that routine testing is available before the pupils go back or when they go back. So I'd like clarification on that. The First Minister is very controlled today, but she has been previously irritated by comparisons with England on the rollout of the vaccine, but it is a fair benchmark to make because we need to be ambitious to what could be done. We are way behind where England is, and we need to work harder to catch up with them. The First Minister clings on to the care homes explanation for the slow rollout, but there was no reason to hold back the rest of the programme while we did the care homes. So I think she should ditch that explanation from now on. I do want to praise the teams for vaccinating 35,000 people yesterday. At last, we are moving in the right direction. But it has taken 7 weeks to get there, and we're still behind England by a margin of 200,000. That's what could be done if we were keeping pace with England. So what new steps will the First Minister put in place to close that gap?
First Minister.
I'm not clinging onto anything. I'm trying to explain rationally, and people can make their own judgments on this. That's perfectly legitimate. I'm trying to explain rationally the trade-offs in the early part of this programme between, as I described it in shorthand terms in my statement, between depth and breadth. Now, as we go further into this programme, I don't think that is the same trade-off as we try, as we are now doing, to do both. But in the early stage of the programme, and it's not just in care homes, it's in the over-80s as well, making sure that we are absolutely maximising uptake in these most clinically vulnerable groups. Now, I think the information we are publishing on a daily basis on the breakdown of vaccination is much more detailed, I think, than other parts of the UK, so I don't have comparable figures, but 98% of people in care homes actually vaccinated is a different thing from saying 100% have been offered vaccination. I don't know what the actual vaccination rate is in care homes elsewhere in the UK. And similarly on over 80s, I suspect now we are getting to an uptake on over 80s that will be at least the same as and possibly even higher than it is in other nations in the UK. We estimate, and there's still work going on to refine some of the overall numbers in the cohort here, but we estimate we are getting close to 90% of over 80s that have actually had the vaccination. Now, these are extraordinary uptake figures, and it's a great credit to people who are coming forward so enthusiastically for vaccination. Now, that matters because these are the groups that are most likely to become ill and die. And that's what we know right now that the vaccine has an impact on. We don't yet know, we hope it does, but we don't yet know that it has an impact on transmission of the virus. So that is why we have concentrated in the early part of the programme on that depth. And now, as we see today in the numbers I've reported, and obviously we have to monitor that going forward this week and into future weeks, we see that start to be replicated in the breadth of the programme. So these are legitimate questions, and there is a legitimate argument that can be made that says we should just have gone for breadth rather than the depth. I accept that, but I think my judgment is that we have approached this in the right way, but it is right that we are under serious scrutiny in terms of making sure the pace of this now is what people expect, and I don't complain about that for a single second. Every one of the questions and every ounce of the scrutiny that has been rightly applied to me, I and the Health Secretary are making sure that is applied in the system as well, so that we get this moving at the speed we need it to. And in terms of the question, what are we doing additionally? This is all in the planning and in the deployment plans that the Health Secretary has set out in terms of, as we go into the younger age groups, bringing more of the mass centres on stream, as has happened this week. These mass centres not necessarily as appropriate for the older age groups who I think prefer to be done in their GP surgeries, but now that mass approach to vaccination as we go down the age groups becomes much more important. So I would not just expect, I encourage Parliament to keep intense scrutiny on this, because it's in all of our interest that we get this programme going at the speed that we all want it to.
Thank you. I'm conscious we have about 16 other members wishing to ask questions. Annabel Ewing to be followed by Maurice Golden.
Thank you, Presiding Officer. The extension of lockdown to at least the end of February will come as little surprise to my Cowdenbeath constituents. However, people, I believe, do want to know where we are headed so that they can have some hope. So can the First Minister therefore confirm, when lockdown is lifted in due course, that we will revert to the strategic framework tiers approach, with the consequent possibility of moving down from tier 4 to lower levels and therefore seeing greater normality in our lives? Thank you.
First Minister.
Yes, we do hope as we come out of the lockdown restrictions we're under right now that we will move back to a level system where we apply restrictions in different parts of the country dependent on the prevalence of the virus in different parts of the country. We're currently conducting a review of the level system that we had applied previously to make sure that we have learned from the experience of that, but also the content and the indicators of that previous level system remain appropriate in the light of where we are now, and particularly that they remain appropriate in light of the new faster circulating variant of the virus. So we will, over the next couple of weeks, update on that review and start to look ahead to when we might be able to come out of a national or virtually national lockdown into that more varied approach, depending on how the virus is behaving in different parts of the country. As I said in my statement, we hope to be in a position that round about the start of March, we can start to look ahead to what may be a gradual, but nevertheless a definite easing of the current restrictions that we are under. But that will depend on our progress on vaccination and on suppressing the virus right now, and it will depend on having sufficient headroom to do that beyond the headroom we need to get children back to school. So right now, any headroom we think we have, we want to use to get children back to school. Once we think we've got enough, we can move on to easing restrictions for the rest of the population. But right now, in summary, I think all of us as adults have to be prepared to live with some restrictions for longer in order to get children back to greater normality first.
Maurice Golden, to be followed by Stuart Macmillan.
Thank you, Presiding Officer. Last week, in an answer to my written question, it was revealed 14,000 pupils didn't have access to devices for online learning. Many of those in our most deprived communities, including 1,800 in Renfrewshire, 1,700 in West Dunbartonshire and 1,300 in Dundee. Why is this the case?
First Minister.
We've already made additional money available to local authorities to help them fill those gaps. We've always recognised that there are a number of young people that weren't being reached through the existing digital provision. We made money available earlier on to get devices and connections to a number of households across the country, and the additional money is intended to help local authorities go further and continue to close those gaps. So we will continue to try to do that on an ongoing basis, while of course we're doing the even more important task of getting children back into face-to-face learning.
Stuart Macmillan, to be followed by Ian Gray.
Thank you, Presiding Officer. Can the First Minister clarify the focused role of GPs in delivering the vaccine rollout, and does the First Minister expect this to change over the next 3-week reporting period?
First Minister.
GPs have got a very important role to play in the delivery of the vaccine, and that will continue to be the case right throughout the whole progress of the vaccine programme. In the initial stages, GPs have been focused on vaccinating the most vulnerable. In the last couple of weeks, that has been the over 80s, because we judge that for the older, frailer members of our communities, then access through GP surgeries is the best way of getting them vaccinated quickly. And as I said earlier on, we think getting close to 90% of the over 80s have already been vaccinated. As we go down into the younger age groups, we will make and are already making more use of mass vaccination centres, where people will get their appointment letter to go to. It may not be, somewhere like the Edinburgh Conference Centre or the Louisa Jordan, but it may be a local village hall or community centre to get vaccinated there, while GPs focus on those that are more vulnerable, older, and where it is considered that they are the best places for the vaccination to happen. So this right throughout is going to be a mixed approach. If GPs were asked to do the whole of this programme, they wouldn't be able to do anything else. Likewise, if we didn't have GPs as an integral part of this, then we would miss a lot of people who otherwise would be vaccinated through that way. So we will continue to try to use a sensible approach, and GPs will always be integral to it. And I want to take the opportunity to thank them for the incredible work that they are doing so far.
Ian Gray, to be followed by Bruce Crawford.
Thank you. Today's report from the Poverty Alliance is only the latest, which tells us that remote learning, while necessary, has widened the attainment gap. In East Lothian, the Council has partnered with Queen Margaret's University and the STV Children's Appeal to launch a tutoring initiative to support 300 senior pupils and mitigate the effects of lockdown on learning. With lockdown continuing for most pupils, why isn't the Scottish Government and Education Scotland ensuring that this kind of support is available everywhere?
First Minister.
There is a tutoring arrangement available through the eSchool platform, and we will continue, and we'd be very interested to look at approaches local authorities are taking to see if we can do more to extend them across the country. Everybody recognises the impact that this situation is having on young people, and everybody in government. I, the Deputy First Minister, want to do everything possible to help young people minimise that impact and catch up with learning that they have lost. So the tutoring arrangements are available, but we will be open-minded about anything we can do to extend these kind of opportunities further.
Bruce Crawford, to be followed by Jamie Green.
Thank you, Presiding Officer. First Minister, as far as the vaccine programme is concerned, do you agree that the most complex and challenging stages lie ahead as we seek to both increase the pace of the rollout and ensure second doses are timely administered to the most vulnerable? For instance, now that we have over 610,000 of first vaccine doses in people's arms, we need to ensure adequate supply is available to administer the second dose. What assurances can the First Minister provide in this regard and the future rollout programme?
First Minister.
I think every stage of this vaccination programme is going to bring its own challenges, and Bruce Crawford is right. As I have tried to reflect, we have an obligation and a challenge to make sure that we are going deep into every cohort, maximising uptake, while going through the bulk of every cohort as quickly as possible. So that breadth and depth can't be trade-offs as we go through the rest of the programme. We have to achieve both, and that's what we are very focused on. In terms of the need to start the second doses, some second doses are being administered on a daily basis right now, but as we get to the 12-week point for the bulk of people who have been vaccinated so far, and we have to make sure that the modelling of our supply versus uptake is sufficient to do that, and the assurance I can give is that that is factored fully into all of the assessments and all of the assumptions that we make in our modelling of what the vaccination, what rate the vaccination will happen at over the weeks to come.
Jamie Green, to be followed by Ruth Maguire.
Thank you, Presiding Officer. It is undoubtedly true that the attainment gap is now at serious risk of widening, especially in our most deprived communities. Can I ask the First Minister what has been done now to help pupils catch up with their lost education? And why are so many supply teachers, newly and recently qualified teachers, still contacting us to tell us they're looking for work? Why are they not out there helping those who've been hardest hit by absences? Shouldn't there be a national call for anyone who is able to help to come forth and do so?
Yes, and there should be no reason right now why supply teachers are not able to get work, because we have already made available £45 million to local authorities to employ additional staff. So I would say to local authorities, you should be making full use of any offers of supply teachers that comes your way, because the funding is there to do that, and let that message go out loudly and clearly. There's a range of things that have been done right now to support children while they are out of school, and also to try to minimise the ongoing impact on their education through the digital provision that I've spoken about, through the different resources that are available on the eSchool platform, and the range of ways that we will support local authorities to make sure they have the staffing and the resources in place to support children as they start to return to school. That is vitally important, but I come back to the central point that what matters most right now in this phase of dealing with the pandemic is that we act in a way that opens up the space to get children back to school as quickly as possible.
Ruth Maguire, to be followed by Jenny Marrow.
Presiding Officer, I'd like to ask the First Minister if, as the vaccination programme progresses and the country begins to move out of lockdown, if consideration will be given to prioritising the opening of sports and leisure activities. It was a cause of great consternation to many of my constituents that pubs were open before folk could go to the gym or take part in sport, which could be operated safely and positively contribute to people's physical and mental health.
First Minister.
Well, I think that is a reasonable question, and obviously all of us want to get everything back to normal as quickly as possible, but what we learned last year is that we can't do everything at once, and therefore we have to prioritise, and perhaps we didn't always make the right choices when it came to prioritising last year, which is not to say that it is not perfectly legitimate for pubs and restaurants and other parts of the economy to want to open, because it absolutely is, and I want to see them back to normal as quickly as possible. But we've got to be very clear as we continue down this difficult path, as headroom opens up, what our priorities are. Now, I've been very clear again today that the first priority for the government is getting children back to education, and I think that is something that has widespread support across the country. But I think Ruth McGrath raises a very valid point. After that, what is the order of priority? If we have limited headroom then other facilities that help with the health and well-being of the population absolutely have to be there in our thinking. It's not going to be an easy balancing act this time round any more than it was last time round. But we've got the experience of last time to know perhaps what we think we did right and perhaps what we wish we had done differently, and apply that this time, and that's what we will be seeking to do.
Thank you. Jenny Mara, to be followed by Kenneth Gibson.
Obviously, today's announcement of children getting back to school on the 22nd of February is the most important and is very welcome news. But we do know that online learning is very patchy across the country. Some pupils have the opportunity to speak to their teacher on a daily basis. Others haven't spoken to their teacher for weeks. What is the Education Secretary and the Scottish Government doing to improve this situation and make it more sustainable for those children who don't have that contact?
First Minister.
I mean, again, that's an important question, and I think that is always going to be a challenge for us for as long as children remain out of school. There was the report, the first official overview report on remote learning that was published indicating some important improvements compared to the experience of last year. And certainly my anecdotal feedback from many people across the country is the experience of online learning is much better in this second period out of school than it was in the first. But I recognise that there will be variations from in different parts of the country, so the Education Secretary continues to work with local authorities to make sure that provision is of a uniformly high standard. It is one of the reasons the additional resources were committed to local authorities to allow them to invest in the areas they thought were important. So we will continue for as long as children are out of school to make sure that that provision is as good as it can be. But we've got to recognise candidly, it is not going to ever be as good as having children in school learning face-to-face, which is why I come back to the central point that getting back to that as quickly as possible is our driving priority.
Thank you. Kenneth Gibson, to be followed by Rachel Hamilton.
Thank you, Presiding Officer. I welcome the extension of the £500 self-isolation grant to people earning less than the living wage. What level of additional resources would be required to extend this to people with average earnings or less, many of whom will have families to support and which many of us would like to see?
First Minister.
I don't have a figure to hand as to exactly how much that would cost. I'm happy to have that costed and make that information available. And we will continue to look at further expansions of eligibility as we think we've got resources to support that. We're also still looking at the overall quantum of support and the other practical ways in which people who have been asked to self-isolate can be helped to do that. And as I said, the Social Security Secretary will set out more detail of all of that shortly. But I absolutely recognise, I think we all do, that particularly for people with children, being asked to self-isolate is a really difficult thing to do, and we've got to support people as much as possible.
Rachel Hamilton, to be followed by Christine Graham.
First Minister, at the end of the week, Sunday, the 24th of January, 7,932 new cases of COVID were identified, with 20,555 contacts traced. Can I ask what proportion of that figure her government expect to have self-isolated, and how many contacts are estimated not to have been traced? Does she believe it is important that this data is tracked to increase the numbers self-isolating to break the cycle of transmission?
First Minister.
The survey data we've got on self-isolation, and there's been some work published which is UK-wide quite recently actually, and I'm trying to see if I can find it in my papers here. I can't immediately find it. I'll make it available to the Chamber, but actually it's UCL data, and it suggests that the compliance with self-isolation is relatively high, higher than I thought it might be, but it also suggests that there are still some people who are expressing difficulty in doing so. So the focus we have is ensuring that we understand the reasons why people are finding it difficult and the groups of people that are finding it difficult, and trying to target more support to that. Extending eligibility for financial support is one really important step forward. It's not the first step we've taken. We had previously widened eligibility to include parents whose children had been asked to self-isolate. So we continue to look at how we support more people. Often it's not just financial support, so the outreach service that councils operate, which is dependent on people giving their permission to be contacted. And again, all members could help by encouraging their constituents to do that, which means that councils will telephone somebody and offer more practical support, the delivery of shopping or medicines, up to and including alternative accommodation if they need it. So we need to focus on the reasons why people are struggling and help solve these problems, and that's what we are continuing to do.
Christine Graham, to be followed by Alexander Burnett.
Thank you, Presiding Officer. First Minister, I welcome the extension of quarantine requirements to anyone who arrives directly into Scotland, no matter where they travel from, and understand why the Scottish Government cannot unilaterally extend that to people who travel here via other parts of the UK, for example, England. But given that the importation of the virus is crucial, that we nearly had it eliminated in the summer last year, can I ask if the First Minister, using the current travel restrictions, will tighten checks on those crossing the border?
First Minister.
Well, we continue on an ongoing basis to talk to Police Scotland about their approach to enforcement, and they continue to take what they consider to be a sensible, proportionate approach. But I will ensure that we relay the sentiment behind Christine Graham's question to the Chief Constable and ask him to consider whether there are further steps that can be taken. I know that nobody likes the idea of travel restrictions. I hate the idea of travel restrictions as well as all these other restrictions. But if there is one lesson we need to learn, there's probably more than one lesson, but if there is one overriding lesson we need to learn from last summer, is the danger of suppressing it here, which we did so successfully, and then allowing it to come back in. So that's why it's so important this time that we have much tighter restrictions in place. It's always going to be difficult when we've got the border between Scotland and England if we are not taking the same steps in Scotland as in England. So we will continue to try to support a four nations approach to this as much as we possibly can. But where that's not possible, I think we've got a duty to do as much as we can at our own hand, and that's what we're intending to do.
Alexander Burnett, to be followed by Bob Doris.
Thank you, Presiding Officer. Now, I'm sure the First Minister will join me in urging everyone to take a vaccination once offered. Now, I appreciate this may not be a number she has immediately to hand, but does she have an indication of a number of people who have refused a vaccine so far once offered it, and what is being done to convey to the public the importance of getting vaccinated?
Minister.
I don't have a number to hand, and obviously the numbers in any group, once we've got through a whole group that are not vaccinated, will not just include people who are refusing to be vaccinated. They will include people who perhaps aren't getting vaccinated because of a health condition, or particularly in care homes. I think the 2% that have not taken up the vaccination, that will include people that are very close to the end of their lives. So we need to be cautious in not assuming that those who don't get vaccinated in any group are all refuseniks, people who are sceptical about vaccine. But the general point is really important here, and I think it is incumbent on all of us to encourage people to come forward. What I would say, and the figures speak for themselves here, in the cohorts where we have almost completed, the uptake is very, very high. If you had told me a few weeks ago that we would get to 98% of older care home residents vaccinated, I don't think I would have believed it. And if you had told me we would get to 90% of over 80s, I would have been equally sceptical. So that suggests there is an enthusiasm and a willingness to come forward for vaccination, and the numbers who are refusing to do it are very, very small. But we must all work hard collectively to make sure they are as small as they possibly can be.
Bob Doris, to be followed by Neil Findlay.
Presiding Officer, local authorities and teaching unions are key partners in making a success of the rollout of the routine asymptomatic testing for school staff and senior phase students, and getting schools back safely, even if initially on a phased basis. Can I ask the First Minister, what discussions have you had with councils and teaching unions on these matters, which can help offer a reassurance for those who are currently working within schools, but just importantly for those staff members who may be returning to schools shortly?
First Minister.
The Education Secretary in particular has ongoing discussions with the education unions and representatives of education staff and councils through the Education Recovery Group. I think, my apologies, I think I omitted to address a question that might have been Ian Gray that directed to me earlier on about the timing of testing starting compared to the schools going back on the 22nd of February. We are intending that the beginning of that aligns with schools going back, but the Deputy First Minister will write to members with specific detail of exactly when and how that is going to be introduced. But you're right that those who work in our schools are key partners in all of this, and it's important that we continue to work very closely with them.
Neil Findlay to be followed by John McAlpine.
It's taken a full year to provide schools with home testing, and we keep being told that the government is looking at vaccinating those who work in schools. What does looking at it mean, and will these staff have to wait a similarly long time to be vaccinated because they are in the front line?
First Minister.
In terms of vaccination, I'm not sure if he still does, but as somebody who I know has shadowed the health portfolio for a lot of time, I would have assumed Neil Findlay would have known what looking at it means. It means considering and taking account of advice from the JCVI, for example. They have given us the advice on the first groups based on the clinical priority, those, to be blunt, that are most likely in descending order to become ill and die. And as we go into the wider part of the population, as the Health Secretary said earlier on, the JCVI will consider whether they want to advise on priority, and we will then consider, and as we always have done in the past, in all likelihood, adopt that advice. It's important to stress that there will be teachers who are being vaccinated, have been vaccinated, and will be being vaccinated right now as part of these priority groups. People who have or who will be beginning to, that are part of the clinical extremely vulnerable groups, for example. So that is the way in which any vaccination programme should proceed, based on clinical advice, which is based on clinical priority. And of course, we want to get to the point where the whole adult population has been vaccinated as quickly as possible.
And Joan McAlpine.
Thank you very much. The First Minister will be aware that the JCVI clinically extremely vulnerable list includes everyone in receipt of carers allowance and all unpaid carers of elderly or disabled people who would suffer should that care be withdrawn if the carer tested positive or was required to isolate. Can the First Minister offer reassurance to this group that they will be vaccinated with the rest of the clinically extremely vulnerable group this month? And is she confident that the system has been able to identify them all?
First Minister.
I'll ask the Health Secretary perhaps to write just with more detail of the answer I'm about to give here, but yes, we are confident that anybody who is in the clinically extremely vulnerable group will be vaccinated in the timescales I set out earlier on. With all of these cohorts, there are definitional challenges of making sure that we are properly capturing people that need to be in them and identifying everybody who is in them. I've talked a bit today about the estimates we've made for the over 80 group. We think we've slightly overestimated. We possibly slightly underestimated those in frontline health and care staff. So if you look at the figures there, you will see we've vaccinated more of those than we said was actually in that cohort. So there will be challenges around this that we need to make sure happen. But those unpaid carers will be getting their vaccination appointment starting from the third week in February. But anybody who's within the clinically extremely vulnerable group will be vaccinated in the timescale that I set out earlier.
Thank you very much, and apologies to Graham Simpson and Alex Hamilton. I'm afraid there's no time for any more questions. We're going to move on to the next item of business. Can I just encourage members to observe social distancing, wear their masks when they leave the chamber, and to follow the one-way systems around the Parliament building. Thank you.
Can I just remind members that social distancing measures in place in the chamber and to take care in observing them. The next item of business is a Rural Economy and Connectivity Committee debate on motion 24025 in the name of Edward Mountain on inquiry into construction and procurement of ferry vessels in Scotland. Can I say to those members who wish to speak in the debate to press the request to speak buttons now? And I call on Edward Mountain to speak to and move the motion on behalf of the Rural Economy and Connectivity Committee. Convener, please.
Thank you, Presiding Officer, and I'm pleased to contribute to this debate in my capacity as convener of the Rural Economy and Connectivity Committee and to move the motion. Presiding Officer, we published our inquiry report into the construction and procurement of ferry vessels in Scotland in December 2020, over a year after we started it. And I would like to thank the many people who gave evidence to the committee, either in person or via written submission. And I'd also like to thank the clerking team who assisted us in the report. Now, we can only note the Minister's response to the committee's unanimously agreed report, which is very dismissive of our findings. On the public procurement side, our inquiry has revealed a catastrophic failure in CMAL and Transport Scotland's management of the procurement of vessels 801 and 802. We have concluded that the current procurement processes and structures are not fit for purposes. The Scottish Government's disdainful response to the committee's critical conclusion is frankly surprising. Contrary to the Minister's assertion in his written response that the committee did not highlight in detail the poor performance by the shipyard's former management as a contributory factor to the problems of this project, we did. It is clear, that, however, that the procurement process that the Minister attempts to defend was not fit for purpose. There can be no bigger failure in the process than the inability to identify at the outset that the bidder lacked the management and financial capabilities to fulfil the contract. That is precisely why the committee has called for an independent external review of the procurement processes. The Minister clearly needs to reflect further on this recommendation and to take steps to ensure lessons are learnt and that failures are not repeated. Turning to delays and cost overruns. The cost of delivering these vessels has ballooned from an original budget of £97 million to an eye-watering £200 million, and we are still counting. The ferries will also be delivered 4 to 5 years late, with islanders and other users paying a huge cost for these delays. The committee has called on Audit Scotland to undertake a detailed audit of the financial management of this contract. The committee, as I am sure do taxpayers, welcome the Scottish Government's willingness to cooperate fully with this inquiry. Turning to commercial loans. There has been a complete amazement with the Minister's response to the issue of the £45 million of Scottish Government loans made to Ferguson Marine Shipyard. The committee highlighted a total lack of transparency surrounding the purpose, agreement and payment of these loans. It is disappointing that the Minister appears to want to ignore these findings. These loans have effectively been written off following the nationalisation of the shipyard. It is therefore essential that the Scottish Government honours its commitment to cooperate fully with Audit Scotland in investigating the process it followed. The committee made specific recommendations to improve transparency and accountability with respect to future loans, and these must be fully considered and, where appropriately, implemented. Now, turning to the relationship between CMAL and female. The inquiry heard evidence that problems with the contract were not helped with the relationship between the former management of Ferguson Marine and CMAL, which became more than toxic. The Scottish Government's response records disappointment that the inquiry report does not reflect the extensive and proactive steps taken to facilitate and negotiate a better outcome with the contractor. It is clear, whatever those steps were, they failed. As the inquiry concludes, the Scottish Government should and could have acted more quickly and decisively to address these matters. It is notable that CMAS first expressed concerns to the Government in March 2016 that the contract was running behind schedule. However, the doomed attempts at mediation were not initiated till a year later. At this point, it should be remembered that the contractor had received £74 million of the total cost of £97 million in contractual payments. Given this disaster, the committee believes there must be stronger provisions on the application and enforcement of dispute resolution mechanisms in future contracts, especially of this nature, to prevent any repetition. Turning to the engagement with local communities. One of the most concerning aspects of the delay and spiralling costs of delivery of these vessels has been the impact on island communities. The committee heard widespread dissatisfaction about the limited opportunity for local communities to input meaningfully into the ferries policy. I therefore welcome the Minister's commitment to bring forward a revised communications and stakeholders strategy. This strategy must include much better and genuinely meaningful engagement on the design and delivery of new ferries. Turning to the future decision-making structure. The committee inquiry has exposed a cluttered decision-making landscape, lacking in transparency. It is clear all decision-makers involved, including the Scottish Government, have failed to some degree to effectively discharge their responsibilities. We accept that plans are already underway to review the current legal structures and governance arrangements around the provision of ferry services. Despite the Minister's belief that the current tripartite arrangement works well, this review must reflect the root and branch overhaul that the committee called for. The Minister should be mindful of the committee's suggestion that this could go as far as to result in certain bodies being merged or perhaps even abolished. Turning to the future procurement and construction strategy. The committee has concluded that the approach to procuring and delivering new ferries has to date been short-term, piecemeal and lacking in strategic direction. On this basis, the forthcoming Islands Connectivity Plan cannot be a business-as-usual updated version of previous plans. We cannot afford to have an increasingly ageing and unreliable fleet which causes major service disruptions on a regular basis. The committee is calling for nothing but a complete and the committee is calling for nothing short of an overarching strategic long-term vision for all vessels serving Scotland's ferry network, underpinned by an appropriately funded plan to replace the entire existing ferry fleet over the next 25 years. Presiding Officer, in the short time that I've been allowed, I have focused my remarks on the key issues raised by the committee. The committee believes that the Scottish Government has a responsibility to face up to the catastrophic failures that have contributed to the myriad of problems with this contract. It is simply not good enough to dismiss the conclusions reached unanimously by this committee on a cross-party basis. One simply cannot blame the contractor for all the failings. Good leaders and good systems prevent failures. Poor ones don't. We must ensure that lessons are learned, that the costly and damaging mistakes that are evident here are never, ever repeated. We believe that reforms are needed to ensure our remote island communities remain connected, and that, Presiding Officer, is what the committee has highlighted in our report. Thank you.
Thank you very much, Mr Mountain. Now call Paul Wheelhouse to open for the Scottish Government. Minister, please.
Thank you, Presiding Officer. I welcome too the opportunity to respond to the committee report today on behalf of the Scottish Government. And I'd like to take the opportunity, as the convener's done, to thank committee members and their clerks for the detailed work they've done and the consideration of what the report clearly acknowledges are broad-ranging, complex and important issues, and thank also the many stakeholders who fed into that, not least the communities themselves. We shouldn't forget that at the heart of these issues lie the communities that rely on the vessels in the fleet, the crews that operate them and indeed the skilled workforce at the yard at Ferguson's. These key groups have been at the forefront of our minds throughout all of this and are why we stepped in to save jobs and the yard and to ensure the vessels will be delivered. At the outset, I also want to reiterate that, notwithstanding lessons learned, we remain fully supportive of the efforts of CalMac, CMAL and Transport Scotland in delivering ferry services on the Clyde and Hebrides network, and indeed the work undertaken by CMAL to support services to the Northern Isles. However, as set out in my written response to the committee, we also recognise the challenges in doing their work and the need for continuous improvement, for investment and to optimise delivery of infrastructure to support our lifeline services. Along with my colleagues, particularly the Cabinet Secretary for Economy, Fair Work and Culture, I've taken time to reflect upon the content of the report. And as set out in my written response, there are some conclusions in the report with which we do not agree, and some instances where we believe the conclusion or recommendation doesn't necessarily fully reflect the breadth of evidence presented to the inquiry. However, and I stress this for the convener's benefit and other members of the committee, we do recognise that the committee focuses in relation to the two ferries and the delay in their delivery. The outcome has been particularly impactful on communities awaiting the delivery of ferries that have been yet to be completed, and clearly the cost outturn and delays are far from what was anticipated or desired at the point of contract award to FML. We accept that lessons have to be learned, and I want to reassure members they are being learned. However, I would again reiterate our view that contractor failure played the primary role in these difficulties, and we are disappointed. I appreciate the convener's points, but this was not more fully reflected in the final report, although I accept, as is the committee's right, the committee has the right to take its own view on these issues, but the government is also entitled to take a view as well. I would, though, also take this opportunity to refute comments made by some following publication of our reply to the committee, and it's clear from the commitments I'm about to reiterate that we have indeed reflected on the feedback and are already implementing improvements that colleagues may welcome. Presiding Officer, we've already committed to commission a study on the legal structures and governance arrangements which exist between the tripartite group of Transport Scotland, CMAL and CFL. This relationship was considered at length throughout the inquiry, and I can assure the Chamber that the organisations involved have committed to engage constructively in that review process and to reflect on the recommendations produced. However, we also recognise and we want to safeguard areas in which the tripartite arrangements are judged to perform well now. Preparation for this project is well advanced, and we are currently evaluating submissions from advisers with a view to commencing this work shortly. And I'll update the committee on the initiation of the work, and ministers will also update the committee or its successor committee accordingly on progress and outcomes on that important work later in the year. We're absolutely committed to the principle that those directly affected by decisions around ferry services are able to engage in the decision-making process in a meaningful way, and I certainly note the convener's remarks around this being an important area of the committee's report. As was evident during the inquiry itself, there are often competing views from different groups, and it's important to balance these within our decision-making, and this will include consideration around value for money, around the lifetime costs of any investment as well. We have already begun the process of developing a revised communications and stakeholder strategy, and I welcome the positive feedback on Transport Scotland and CMAL's most recent engagement on the new Isla vessel provided to the committee by the CalMac Community Board. And we'll continue to build on these improvements with stakeholders to develop greater transparency in how community views are received and included in our decision-making. In particular, we'll provide a clear explanation of why specific design decisions have been reached and why in instances where the community or individual preferences have not been reflected in the final outcome. Indeed, as an example of ongoing engagement, CMAL, CalMac and the Transport Scotland held a webinar on the 14th of January to outline the analysis around the new Isla vessel options and how stakeholder views had helped shape the consideration and investigations currently underway, and there were 140 individuals who attended that webinar. We'll also publish a ferry stakeholder engagement strategy later in the year to improve engagement with communities. On due diligence, whilst audits have demonstrated compliance with public procurement procedures, we are committed to enhancements of arrangements where possible. And to that end, CMAL are committed to an enhanced due diligence process for all contracts of value greater than £500,000. CMAL also intend to engage the services of a shipbroker to enhance analysis around shipyards, including established track record, their skills and competencies, and first-class products. An additional level of assurance for tender assessment will be introduced by engaging naval architecture companies to support the process. I also note the committee's request to provide updates regarding costs and programme. We are committed to being transparent and reporting the progress on hulls 801 and 802, and I note that Tim Hare from Ferguson Marine Port Glasgow provided an update to the REC Committee on 19th of January regarding COVID-19's impact on production at the yard. It's my understanding that a further case of COVID was detected, with the individual being sent home from work and has been self-isolating, along with 11 suspected close contacts in line with the test and trace procedures. And may I take a moment to wish a speedy recovery to those individuals involved. I note the convener and the committee's concerns regarding the purpose of the commercial loans provided to FML by the Scottish Government and sharing of information about them with CMAL, which was referenced by the convener. And the purpose of those two loans is recorded in the contract documentation published on the Scottish Government website for September 2017 and June 2018 loan agreements, alongside the conditions and monitoring associated with the loans. We took great care to ensure proper separation between the two contractual spheres and could not share confidential commercial information with any of FML's clients, including CMAL, without breaching its duty of confidentiality to FML at the time. However, Scottish ministers did have a full understanding of the complex commercial and contractual issues at play when taking decisions. Presiding Officer, we remain committed to the actions I've outlined to Scotland's lifeline ferry services and to the communities they serve. The Government's actions have also saved hundreds of jobs in Inverclyde and within the local supply chain, and I hope that is at least something we can all agree is a positive outcome. Thank you very much, Presiding Officer.
Thank you. And now calling Graham Simpson to over the Conservatives. Mr Simpson, please.
Thank you very much. Can I start by thanking the committee for its work on this inquiry and for managing to unanimously agree a report and a set of challenging and robust recommendations. Now, I was looking through my dictionary for the definition of humility. It is to show that you are conscious of your failings. And normally, when a government is lambasted in the way this government has been in the committee report on the construction of ferries, the Minister would have done just that. He or she would have taken the criticism on the chin, thanked the committee for its diligent work, promised to take the action they called for, and vowed never to let anything similar happen again. When I found the word humility in the dictionary, I also found two other words nearby: humble pie. And that is what the Minister should have been eating. Instead, what we have had is my final word from my lexicon labours: humbug. The Minister's response was nothing short of a disgrace, appalling, in denial, shameful, arrogant even. It was unbelievable from start to finish. In essence, the Minister, or whoever it was from Transport Scotland who wrote his response, was saying to the committee, "We gave you the evidence, but you didn't listen to us, so you are wrong." At the heart of this is the complete failure to deliver two ferries on time and on budget. They are neither.
Briefly, Minister.
I'm grateful to the member. I'll keep this brief, Presiding Officer. Would the member acknowledge, in the speech I have just given at the outset of this debate, we have acknowledged significant areas where the report made recommendations we have adopted? Are we not, though, also entitled to say where we believe the balance of the evidence said something different? We certainly accept the committee's report and we will support it, but we are identifying that there are some
not brief enough, Minister.
We disagree with.
Mr Simpson.
I don't think he has accepted anything in the report from what he said. The ferries will be up. You see, he's saying I'm not listening. It's just like he's told the committee, you didn't listen. The ferries will be up to 5 years late if they're ever finished, and the cost has more than doubled. If ferry owners CMAL, a government body, was privately run, it would be out of business by now. The upshot is that the taxpayer is out of pocket, nothing new with this government, and the communities that the ferries are meant to serve have to put up with old vessels, much like the rest of our island communities. The committee said it believes there's been a catastrophic failure in the management of the procurement of vessels 801 and 802, leading it to conclude that these processes and structures are no longer fit for purpose. And anyone taking a rational analysis of what's happened would conclude the same. But the Minister, in his breathtaking response, says, "We do not accept the committee's description of a catastrophic failure." It's not his fault. It's not the fault of Transport Scotland. It's not the fault of CMAL, both arms of the government. The government and its bodies are, in his view, entirely blameless for what has gone wrong. There's nothing to see here now, so move along, please, everyone. Well, if Minister Paul Wheelhouse really believes that, then he should change his name to Paul Asleep at the Wheelhouse.
Can I just say to members, sit down just a minute, I have no spare time in hand, right? So just make that plain to members now. Minister, you can deal with this, you're summing up. So just to let you know, I'll give you a little bit extra, but I can't do it after this, I'm sorry.
I'm grateful. I'm grateful. Nobody but the Minister and his chums in Transport Scotland and CMAL agree with his response. He should have been taking the committee's report and using it to knock heads together at both these organisations, but he hasn't. He frankly looks afraid to rock the boat with CMAL or Transport Scotland, the former of which, instead of showing some corporate humility, is actually expanding its empire. It's extraordinary. The committee said that a root and branch overhaul of current decision-making structures is urgently needed, and that this should consider the relative roles and responsibilities of all bodies involved in decision-making around the procurement of new vessels, and it should streamline the decision-making structures by merging or abolishing certain of them. They mean CMAL. What they are saying, and I agree with them, is we do not need CMAL. They also say that the next Clyde and Hebrides network franchise should be for a much longer period of time than is currently the case. That would give the operator the chance to take responsibility for the ferries, to procure their own, and get on with modernising an ageing fleet that is not fit for purpose. That's a model which is followed successfully elsewhere in the world, such as in British Columbia in Canada. One of the most concerning aspects of this debacle, for me, has been the loss of tens of millions of pounds in loans from the taxpayer. There's a pattern emerging here where the SNP government ploughs money into private firms, which is then lost forever. We've also seen it with BIFAB recently, but there's never a hint at contrition. It's almost as if it doesn't matter. At the end of the day, the taxpayer has lost out through this fiasco, but perhaps more importantly, so do the disgruntled island communities who deserve better. And that's why we need Audit Scotland to urgently investigate. The way forward is not to bury your head in the sand, but to listen to the MSPs of all parties on that committee who've said unanimously that wholesale change is needed. Thank you.
Thank you very much, Mr Sims. I call on Colin Smith to open for Labour. Mr Smith, please.
Thank you, Presiding Officer. There's much that can be said about this ferries fiasco, but it can be summed up in 3 words in the Rural Economy Committee's report: a catastrophic failure. 2 ferries, 100 million over budget, double the planned cost and rising, and 4 years at least late, depriving our island communities of these lifeline ferries. Yet astonishingly, and I have to say, arrogantly, the Scottish Government's response in the Minister's dismal letter to the committee is to say, and I quote, "The outcome has not been that for which we had hoped." The very definition of an understatement. It was a shocking response from a government that is in denial, out of touch, and thinks it's beyond criticism. No humility at all, and no apology again from the Minister today. Presiding Officer, it's just not good enough. Not good enough for Scotland's taxpayers, for ferry passengers, for the workforce at Ferguson's. They all deserve a lot better. Week after week during this inquiry, the committee received damning evidence exposing weaknesses at every part of the process and mistakes from every organisation involved. The clear conclusion: the procurement processes and structures are, and I quote from the cross-party report, no longer fit for purpose. A conclusion few could credibly argue with. It's why the committee was unanimous in calling for a root and branch overhaul of current decision-making structures. The committee hoped the report would act as a stimulus to improve how things are done, to ensure we never again find ourselves in this position, to create a ferry procurement system that is fit for purpose. Instead, the response from the government is, and I'm sorry to say this, tinkering at the edges of a process whose failings were not just graphically exposed by this fiasco, but in fact were already flawed. A process that is too disconnected from the communities our ferries are supposed to serve, too slow to replace our ageing vessels, and too short-sighted to provide certainty to the shipbuilding industry in Scotland. There has clearly been a case for a fundamental overhaul to the processes for some time, and this fiasco has just made that an urgent necessity. The committee's aim throughout was not to point fingers or lay blame needlessly, but to identify what went wrong, to learn lessons for the future. But the Minister's response makes me fear for the future. To be fair, I do sympathise with Paul Wheelhouse. He's been left to clean up the mess made by the inaction of previous ministers to meaningfully intervene when the government knew these contracts were going so badly wrong. And the failure, I have to say, of the First Minister and Derek Mackay to give evidence to the committee leaves us unable to answer questions over why ministers made the particular decisions they did and failed to take more robust action to intervene at an earlier stage. But, Presiding Officer, the refusal of the government to acknowledge the significant structural failures of the process does beg the question, what did go wrong according to the government? Their answer appears to be that it's all down to failures on the part of Ferguson's Marine. The Minister said in his letter, contractor failure has been a very significant factor in the difficulties we have seen, highlighting, and again I quote, the contractor's non-performance, contract management and financial management described in independent evidence to the inquiry. The committee certainly highlight questions over these issues, including the management and financial capabilities at Ferguson. And we heard from the workforce whose own concerns were clearly ignored by Ferguson's management at the time. There is clearly a need, however, for Audit Scotland to undertake a more forensic inquiry into the financial management of the contract by CMIL. And I have to say the role of ministers in the process, including the awarding of contract loans to Ferguson's. But I do find it astonishing that the Scottish Government think blaming contractor failure alone is a good defence of the procurement processes which gave them the contract in the first place. If this entire fiasco is almost exclusively, and that's what the Minister said, almost exclusively as a result of the mismanagement, incompetence and the lack of capability on the part of Ferguson's Marine, then how were they awarded the contract in the first place? It exposes the fact that in awarding this contract, there was a clear lack of robust due diligence on the part of CMIL in assessing the financial stability of Ferguson's and its capabilities in areas such as project management and design. And it raises serious questions over the Scottish Government's willingness, indeed political desire, to proceed despite what we now know were significant risks. That deserves further investigation, and if necessary, I have to say, criminal investigation as to the awarding of this contract in the first place. This does not undermine Ferguson's at all. Indeed, quite the contrary. This yard was more than capable of delivering ships, but we know now it was not capable of delivering this contract. It's clear to me that CMIL failed in its duties when it came to due diligence, and the time has come to consider whether an organisation for which there does appear to be no legal requirement should actually exist at all, and in fact should be scrapped. In conclusion, Presiding Officer, the one group of people who were not to blame for this fiasco is the Ferguson's workforce, and I want to highlight the committee's recommendation paying tribute to the skills and dedication of those workers. That workforce have been a credit to the yard in the most challenging of circumstances. I'll say more in my closing comments about the future processes, but we should pay tribute to the workers and the importance of maintaining those skills and that yard when it comes to future procurement of ferries in Scotland.
You must conclude, sorry. John Finney, please, open for the Greens, please.
Thank you very much indeed, Presiding Officer. Colleagues on the Rural Economy and Connectivity Committee will know that I wasn't an enthusiast about this inquiry. I wondered what we could achieve other than a cursory examination of what are very detailed issues. I have to say the committee gave it its best shot, but I still believe that it wasn't going to bring one single ferry one day earlier to the constituents that I'm obliged to serve, and it actually was a distraction, not least from the catastrophic Brexit. The lead role in this lies with the Scottish Government. They have overall responsibility and they should have taken charge, and it's entirely reasonable for them to be held to account. The Minister's letter has been alluded to. I won't labour the point. I think there's been points made about it. But to say Scottish ministers remain fully supportive of our transport agency, Transport Scotland of Caledonian Marine Assets Limited, that's simply disappointing. Now, the Minister rightly points out that these structures were in place before 2007,
but then goes on to reflect on whether the governance arrangements between the tripartite bodies remain fit for purpose, having regard to the overarching objectives of effective, efficient and economic delivery of lifeline services. Really? Ministers don't know the answer to that already. I want to turn to CMAL, and most folks would go, who? And who indeed? I think we get a flavour of CMAL from a series of tweets they put out at the end of December, presiding officer. And I bear no ill will to any of the people that whose posts I refer to. They announced that they were appointing a new financial director who would be responsible for CMAL's financial strategy to provide efficient, cost-effective and safe ferries, harbours and infrastructures. Well, that would have been very good to have had that. Cost-effective is not building vessels that don't fit harbours. It is listening to your customers. And we saw the shambles with Isla Lewis and Ullapool. And notwithstanding the webinar, I fear we may be about to repeat it again with Isla. A head of support they want, overseeing the successful implementation of strategies, plans and policies. That was clearly absent with 801 and 802. Now, the tweet that I did find interesting was that they were leaving the Port Glasgow headquarters temporarily to make way for an office expansion project. I'd make that move permanent. I'd a different sort of removal altogether. CMAL need removed from the equation. The so-called cluttered landscape where no one takes responsibility for anything. A protective shield for the ineffective Transport Scotland, both frequently missing in action in this, and a further buffers to minister. Now I'm going to turn to Ferguson Marine, and I would echo the comments of Colin Smith there. Outstanding skilled workforce. But as regards the management, Mr McCall, initially not playing ball with us, jetted in from his tax haven with his film crews in tow, dumps a large dossier on the table, pontificates and jets out again. It suggested to me not a penny of his personal money went into this project. He wanted the profile, he had his chance, he failed. He has limited scope for criticism of others. He lacks credibility on this issue other than as a failed shipbuilder. Self-evidently things went wrong, but there is an opportunity. We're a maritime nation. We need a fleet of new vessels. We have a workforce with proven skills, with a yard. The yard was saved. And the Scottish Government should embrace the word nationalisation. There's to their credit that they saved this yard in the community, but they do need to get a grip. And finally, I'd like to say about the operator, Calmac. The innocent party in all this, a 6-year contract is inadequate. It should be much longer. The Seaport contract is 15 years. I would award it directly, and this would assess with forward planning, with fleet, show the fleet and infrastructure aligned. There's much to be learned here about an integrated transport system. There is a role for Audit Scotland. I'll leave it there. Thank you.
Thank you very much. Now I call Mike Rumbles to open for Liberal Democrats. Mr Rumbles.
Presiding Officer, I want to re-emphasise to colleagues that the committee report was a unanimous one. We've heard that already. All committee members constructively engaged with each other and with our witnesses throughout the process. What was the aim of our report? It was simply to influence the Scottish Government on how best to improve the system of ferry procurement. And to do that, we had to examine in detail what had led up to the situation where the current system had failed simply to produce the goods. By and large, committee members successfully resisted a partisan approach to this. I was particularly concerned that committee members did not divide on this report, because it had been my experience since our Scottish Parliament was established back in 1999 that we were far more likely to get the Scottish Government to act on our conclusions and recommendations if we worked constructively together to reach a unanimous report. And I thank my colleagues for working to do just that. We've done it. But that is why I'm afraid I'm so astonished and disappointed with the Scottish Government's written response to our report. Presiding Officer, to solve a problem, you first have to accept that a problem exists. If that isn't done, then no matter how many constructive recommendations are made, they will be ignored. That is what the Scottish Government has so far done with our report. I quote from our report the words catastrophic failure. I quote, the committee believes there has been a catastrophic failure in management of the procurement of vessels 801 and 802, leading it to conclude that these processes and structures are no longer fit for purpose. The committee believes that the experience of the ferries contract has exposed a cluttered decision-making landscape that lacks transparency and where there has been varying degrees of failure by all of those with decision-making responsibilities, including the Scottish Government. What is the Scottish Government's written response to our unanimous report? And I quote, Scottish ministers remain fully supportive of our transport agency, Transport Scotland, of Caledonian Maritime Assets Limited, CMAL, and of Calmac Ferries Limited, CFL. So much for our unanimous view that the system is not fit for purpose. The Minister says, and again I quote, "I trust that the evidence provided by Scottish ministers has assisted the committee with its understanding of what is a well-established process with the parties' roles and responsibilities clearly set out." And again from the Minister, I am satisfied that procurement in relation to 801 and 802 were undertaken fastidiously, in good faith and following due diligence. Contrast that with one of our witnesses on being asked why a bid that was the highest quality, but also the highest price was successful. He responded, and I quote him, "I do not know the answer, but three things bring to mind. One is incompetence, another is vested interest, and the final one is corruption," unquote. Personally, I feel the answer to that question is simply incompetence, more than anything else. But for the Scottish Government to turn a blind eye to the evidence from so many witnesses that there were real problems and many deficiencies in the whole procurement management system is quite mind-boggling. What I actually expected from the Scottish Government in its response to our report was an acceptance that things had gone badly wrong with everyone making mistakes along the way. What did we get? The Minister actually criticising the committee. I would, however, respectfully record some disappointment, basically criticising the committee for not blaming the management of Ferguson's even more. Presiding officer, I said earlier that to solve a problem, you first have to acknowledge that there is a problem to solve. The Scottish Government is simply blaming the contractor, does not see its own failings and that of its agencies. I am sure now that our report will end up simply gathering dust on the Scottish Government self, and there are none so blind as those who will not see.
Thank you, Mr. Rumbles. Thank you.
Of everybody's time, taxpayers' money. Minister, you really should have done so much better.
Thank you. I'm sorry, time's very tight. Open debate. I call Stuart Stevens, followed by Peter Chapman. 4-minute speeches.
Thank you, Presiding Officer. We would not be here today if the project manager and their office conducted their activities in relation to construction of 801 and 802 at Ferguson's Marine with anything approaching normal professional standards. It was not a mere contributory factor. Now, I make that observation as someone who's run projects of a similar financial scale and collections of projects, multiples of the scale of this project. The contract and processes around procurement were industry standard and had worked previously, and they're not just used in Scotland, but widely. The response of those in charge of procurement to the manager's failure, however, was inadequate and substantially contributed to why we are where we are today. Question, did CMAL know about the project manager's failures early enough to have intervened to minimise the damage? And my conclusion is almost certainly. Did the complexity of the procurement structure, which involved CMAL, Transport Scotland and the government, contribute to the problem? Yes, I'm pretty clear. It was more complicated than it needed to be. But the legal requirement to have that structure only ceased at 2,300 hours on the 31st of December 2020. I've never said leaving the EU didn't have some advantages, and this might be just one of them. So I see Graham Simpson nodding to that one. Question. In providing financial assistance to Ferguson Marine, should the enterprise agency have informed CMAL and others of doing so? And my answer, and here I differ from the quite strongly held views, I don't misrepresent him, I hope, of Edward Mountain, is that no, they should not have told them. Now, it's by not being told by the funder through proper oversight of the project, the CMAL should have known by other means. Now, why? In providing support to a commercial company, the enterprise agencies must not discriminate in favour of state companies over private sector ones, although I heard Graham Simpson say we shouldn't be ploughing vast sums of money in a private company. It's unusual from those benches, but there we are. The whole point is that we have to be blind as to whether it's a state company or a private sector company. There's nothing new about this. This is what's termed Chinese walls. Now, I'll just tell you a little story from my own experience. In the 1980s, my spouse was part of a team of advisors to the Distillers Company when they were bidding to purchase Bell's whisky. For my part, one of my teams working for me was a part of the Bell's team on the other side of that takeover battle. There was clearly a conflict of interest in our household between our respective professional interests. The old saw is, he who would a secret keep must first keep secret that they have a secret to keep. My spouse and I discussed nothing about this and knew nothing of each other's involvement in this until 6 months after the event, having lunch with someone who raised the subject, who'd been involved in it. That was the first time we knew we had been on opposite sides of a takeover battle on the stock exchange. That is how it has to work with the kind of Chinese wall. And so enterprise companies must do so in this context. But of course, the examination of the accounts receivable, the knowledge of where the business was getting its contracts for, would have been an important part for CMAL. Concluding, presiding officer, the primary failure definitely lay with the yard, but I do think CMAL could have done more, and I do hope, Minister, that we will look at that very carefully. Thank you, presiding officer.
Thank you very much. I call Peter Chapman to be followed by Stuart McMillan.
Presiding officer, the REC Committee's report into the building of ferries 801 and 802 was damning, and we decided that it was indeed a catastrophic failure. This was our view after a very comprehensive and detailed study of the facts, and indeed led to our unanimous conclusion. So Paul Wheelhouse's subsequent dismissal of much of our report was therefore truly shocking. Paul Wheelhouse has demonstrated an unbelievable degree of arrogance and a worrying degree of ignorance. His response amply shows what we already know about this SNP administration, namely that it shows a shocking level of incompetence, little understanding of business, and a cavalier attitude to wasting millions of pounds of taxpayers' money. Normally, individuals and governments learn from mistakes, but with attitudes like this, it is no surprise that industry has no confidence in this SNP government and that their economic growth rate continues to lag behind that of the rest of the UK. These ships will eventually be delivered, but will be 5 years late and at least 2.5 times over budget. And I note from last week's budget statement that Ferguson Marine is to receive another 47 million in taxpayers' money this year. And yet, incredibly, Paul Wheelhouse says, and I quote, "I am satisfied that procurements for 801 and 802 were undertaken fastidiously, in good faith, and following appropriate due diligence." Really? Well, Minister, that is not what the committee found. Our experience was that Transport Scotland and CMAL applied inadequate due diligence in scrutinising and signing off the procurement process. There was a lack of scrutiny of the financial stability of the winning bidder, and the Scottish Government was willing to proceed despite significant risks associated with awarding the contract to Ferguson Marine. There has been a catalogue of errors and failings by ministers and CMAL, but I was particularly concerned to learn that 4 years after the contract was awarded, 95% of the sign-offs on the basic design of the vessels were still not completed. It is of grave concern that CMAL did not intervene to halt this process as soon as it became aware that Ferguson Marine was proceeding to build at risk without having secured a sign-off of the basic design. Presiding officer, these are the wrong ships given to the wrong yard, and the outcome is island communities across the West Coast suffering a poor and unreliable service. Their promised new ships are nowhere to be seen, and the whole Calmac service is stretched to breaking point. There is no spare ferry anywhere in the system, and if there is a breakdown or a ship needs maintenance, sailings must be cut and islanders' essential journeys abandoned. This makes running a business on our islands already expensive and difficult, almost impossible. So in conclusion, Presiding Officer, this is a debacle of the worst kind. It has cost taxpayers hundreds of millions of pounds, has made life for our island communities more difficult, and far from securing a reliable future for the Ferguson Marine Yard. I believe they will find it difficult to secure new work under the dead hand of this incompetent government and with the abysmal legacy of these ferries. The failure of this yard could well be the final disaster of this whole story saga. A sad end for a committed, skilled and reliable workforce who deserve so much better. Thank you, Presiding Officer.
I call Stuart McMillan to be followed by Rhoda Grant.
Thank you, Presiding Officer. Presiding Officer, first of all, I just want to touch upon a couple of comments that I've heard from colleagues. Peter Chapman there actually complained about the £47 million